Hi, friends. As a computer engineering student, we'll be supposed to do some projects, right? Apart from our subjects and the assignments, we'll be working on some real-time projects, finding solution to some real issues and using our software knowledge to come up with a solution for it. So, when we are asked to do that, we'll be looking for some project ideas. First, we will be supposed to choose a domain. Some may choose healthcare, some may choose agriculture, some will be choosing some other domain that triggers their interest. So, normally we'll have subject books. We'll have the books on data science, then data structures, then object-oriented concepts. So, in terms of programming and in terms of the computer knowledge, we'll be having so many reference books that we have studied as a part of our semester, or we'll be having books on it in our college library itself. But when we are working on a real issue, maybe predicting a disease or providing some solution, irrigation related solution, or some IoT related solution to some farmers or some other real time workers, we are supposed to understand the domain, no, for to understand healthcare or to understand better about how the irrigation system works, about the farming techniques, etc. So for those things, we won't have the complete knowledge, right? We won't get the proper books because we are computer graduates. We won't have easy access to those material. Uh, so I found this issue. So my professors, they suggested me to read the research papers based on this domain, like based on agriculture or healthcare, and from those papers we can get some idea, but I couldn't get the detailed picture of clear picture of how stuff work by reading those research papers. So I'm making an attempt to. Now I'm working on a healthcare project, so I'm making an attempt to describe in detail what I have found about the Indian healthcare, how it works, how they are storing the data, how they are encountering the patients, how the system works. So my opinion is that only if we understand the system, only if we understand the domain better, we'll get a clear picture about how the domain works, what are the real problems, and we can come up with a better solution. So only then the solution will be effective to the healthcare people or farmers or whoever we are addressing the issue. So in this series, we'll be discussing about the healthcare, how Indian healthcare works, and everything, right? So, what makes healthcare unique? So, there are so many real-time domains that we can choose from, but I chose healthcare domain. Just like me, many of you would have liked the idea of working in a healthcare project like a disease prediction or monitoring patients remotely or coming up with an app that tracks our heartbeat or something else. Normally we are used to it, right? We are using our fit smart watches. We are tracking the number of steps we are taking. We are tracking the number of glasses of water we are consuming every day. So everything is mobile app now. You must have come up with an idea about developing an app that will help the patients monitor their health remotely or anything like that. We are in India, so looking at the Indian government, they are taking so many steps to make sure that every citizen in India gets proper and good health care, and every citizen is having access to high quality medical facilities. So we are in rural place, we have primary health centers. In cities we have the secondary health center. And looking at the pandemic, when we were suffering from COVID and all, we can see how cleverly government managed everything. They had a proper, when taking care of the prevention, they had COVID booths, like vaccination camps were installed in each and every village. So even the rural people can have proper vaccination. And they were it was suggested that when we are using a mask, we can prevent the disease earlier. So they were enforcing that rule properly, like we will be fined a huge amount when we are not using our face mask properly. And also they were taking care of the government hospitals at that time. The private hospitals were charging a good amount to take care of the COVID patients, but there were so many government facilities that could take care of the patients freely, but the bed was on demand. Like there were so many patients, right? I can still remember that in some private hospitals, they were taking care of the patients, COVID patients. They were charging a very high amount, but at the last minute, like after giving them care for a few days, when the private hospital declares that they can no longer take care of the patient and they feel that the patient might die, at that time they'll shift that patient to a government hospital. And I know some cases where some private hospital, they couldn't take care of the patient and they got admitted in a government hospital, and there they were taken proper care and they got recovered from COVID and they are still living. So the government is taking very good measures to make sure they are allocating a good amount of budget to healthcare from our GDP every year. So despite having such good healthcare facility in India, still we are facing some issues that you might have known, right? Like late diagnosis or some medical errors mostly. You might have known your family member, or maybe you must have suffered from a small minor issue or injury, but the doctors couldn't have identified it properly. They might have given you false or wrong medication because they themselves couldn't understand the thing, your issue properly. And you or your relative, they must have gone to several doctors or several clinics, and still those doctors couldn't have identified it, and you were under false medication for a really long time. And only after some time, maybe some doctor would have identified it correctly, and after that you must have thought that, oh, this is a very minor issue. Why was I suffering from it for a really long time? Maybe in some cases I have known some people, they had cancer, but the doctor couldn't recognize it earlier, but they were still they spotted it in a very lateral stage, and still they were telling it like this is all the early signs, because they couldn't find any visible symptoms of the disease getting advanced. But and they were just starting the initial treatment, but the patient died within a few months. So to avoid such errors, as a CSE student, we can't completely transform the healthcare, but we can make some steps. We can do something to transform in terms of the technology or something. We can, so these issues might have pondered you, and that might have got your interest to do something in the healthcare domain despite being a CSE student, right? So I must tell you that as a CSE student, coming from a CSE background, we can't transform the healthcare industry completely, but through some techniques we have, like AI, machine learning, or blockchain, we can transform the technical aspects of the healthcare. We can make sure, like we can develop an app. See, mostly medical errors are coming from misdiagnosis, right? So we can come up with an app that tracks the complete medical history from right from birth to the present day we are living. We can develop an app that tracks every single thing. So we won't be consulting the same doctor throughout our entire period. Like we'll be going to some places, we'll be visiting some places, we'll be staying in hostel, we'll be moving to other cities also. So whoever doctor we consult, the medical history, the thing, the what we have consulted, that particular thing should be uploaded to that app, so that even if we visit a new doctor in a lateral point of stage, that doctor can have access to the complete medical history. So the doctor could have a better understanding about us, right? Normally most doctors won't do that. There will be so many patients waiting in the queue. They'll also have pending surgeries to do. So Instead of wasting the doctor's time on sitting with the patient and getting to know the complete history, having a medical history in hand through an app, it will be very helpful, right? But there are some doctors who do that. They'll sit with the patient, each patient, they'll spend 20 minutes, they'll gather the complete history, they'll let the patient talk everything, they'll understand them, and only after that they give the solution. In that cases it will be helpful, but for some when some diseases are spreading fast, or if the doctor has a very tight schedule, so this can help in handy, this can help the medical errors. Okay, so there are many such solutions. This is one issue that I had, that I have been working on. So there are many such issues that are prevalent in healthcare. So we can address it one by one, right? Okay, in this series, let us explore how the Indian healthcare works, how the data is stored, how what data standards they are using, how they are storing the medical records, so how long they are keeping the records, when are they deleting it, how are they claiming the insurance. So all these things about the healthcare we can discuss in the series. Okay, thank you.